Hello, everybody. Thanks for tuning in to another episode of the Strength and Knowledge podcast. I'm very, very excited for this particular topic today and to have this guest on because she has clearly poured herself all into a topic that I think many of us will struggle with, at least for short spurts of time, whether or not it's going through school, life stressors, potentially having children involved in our life. But nonetheless, sleep health is something I think we're realizing more and more the importance of. And I'm very, very excited to bring to you today somebody who is doing a great job of integrating this into the healthcare system. I think sometimes some of the most important things are just creating awareness and being able to initiate those conversations. But nonetheless, very, very excited to introduce Dr. Katie Siengsukon. And she is with the University of Kansas. She's an associate professor in the Department of Physical Therapy and Rehabilitation Science program. So welcome, Katie.
Thanks for having me. I'm excited to talk about sleep and sleep health today.
Absolutely. So, I mean, this was something that, sparked my interest. You were talking on Twitter, and obviously this is part of your Twitter handle. We'll get to that at the end when people want to connect with you. But how did sleep become something that you decided that you wanted to maybe carve out this niche in, or how did it become something of interest to you?
Yeah, that's a great question. And it kind of happened over time, a little bit. And it definitely was clinically driven. I went to physical therapy school and I graduated and I was working full time in an outpatient clinic. And I had so many of my patients would be reporting to me that they were having difficulty sleeping. And, beyond just kind of talking to them about positioning, and I, of course, assumed that my, fantastic PT interventions was going to address the reason they were coming to see me, and that would, indirectly or maybe directly influence their sleep. But beyond that, I didn't really know what to talk to them about their sleep. So that's really what sparked my interest is, coming from that clinical experience. And after practicing full time for a couple of years, I decided to go back and get my PhD. And I kind of knew I'd always go back to school. I love school. I love the setting. I love to learn. I love the environment. And so I went back to University of Kansas Medical Center to work on my PhD. And Laura Boyd was on faculty at KU Medical Center. And she was studying and still is studying factors that influence motor learning and motor recovery in people who had a stroke. And, so studying things like amount of practice and timing of practice and dose of practice. And so this was back in 2004. And that was really the year that there was a bunch of research coming out that sleep is important for learning new skills. So basically what you learn during the day is getting replayed at night. So those memories are getting strengthened. But all the studies had been done in just young college age people to show that, yes, indeed, sleep is important for learning new skills. But no one had ever done it in a neurologic population, particularly in people with stroke. So it was kind of a natural, kind of partnering between her interest in factors that influence motor learning and my interest in sleep. So that's what I did my dissertation on. So a very, kind of niche topic. And so what we found, sleep, yes, is important for learning new skills and recovery in people who have stroke. But what it also afforded me was the opportunity to do a really deep dive into sleep and the importance of sleep. And really learning about how sleep's important for your immune system and for pain modulation and cognitive function and physical function. And I mean, basically every system of our body is influenced and regulated by sleep. And it was one of those gosh, this is so important for our overall health and well-being and for recovery. Why isn't this information that physical therapists are learning about in school? We should be, we need to be. And not only that, but we need to be integrating this information into our practice to help our clients sleep better, because I would suspect that it will influence their recovery and possibly, their length of, time receiving physical therapy. So it really has become a passion of mine to get information out to physical therapists and other healthcare providers, just really about the importance of sleep for overall health and wellness. But also too, I think people, especially nowadays, people know that sleep's important. There's been enough, information in the news and research coming out. And so I think people, they know that sleep's important, but I think where people kind of get hung up, and what I hear a lot is that they don't know, one, how do we screen people for sleep issues? And then what do I do about it? Like, how do I integrate this information into practice? And so that's a big passion of mine. And then I of course do research around behavioral interventions to help people sleep better. So that's kind of a little bit about how I got into sleep, and then also a little bit of what I do.
Yeah, and while you're going through that, I'm thinking in my head, my college years where I was taking some kind of nootropic and thinking that I was going to be able to pull an all-nighter and do a great job on tests is obviously not something that's recommended. And then with regards to certain time periods where sleep has been more challenging in my life, just from business ownership standpoint, whether it's COVID or the early years, recognizing I wasn't at my best. Mm-hmm. And then this conversation also jumps over to where I think people are talking a little bit more about readiness and things like heart rate variability. So maybe some subjective and objective measurements of whether or not somebody's kind of coming back to that baseline or that nice balance between parasympathetic and sympathetic. But without diving into that specifically, what are some very, very easy ways that some of the healthcare providers, the clinicians, can maybe think sleep a little bit more and potentially screen in or out certain sleep issues?
Right. And I think that's a great question. And I think, again, that's where a lot of people kind of have a little bit of pause. And so we actually developed, Ken Miller and I, in collaboration with the home health section, we developed a sleep decision tree to help guide physical therapists, but it also certainly could be applicable to other healthcare providers, to help guide clinicians to screen individuals for sleep issues. Because, we're not board certified physicians in sleep medicine. Like, they go to school for a really long time and they are the experts in assessing and treating sleep disorders. But I think it's very reasonable for physical therapists to be screening for sleep issues. And then, of course, the big thing too is in referring people who do screen for a possibility of having a sleep disorder. And so in that decision tree, we include kind of the first tier of questions is asking questions about sleep duration, sleep quality, how do you feel when you wake up in the morning? And then the next tier of questions is about, how is their condition that brought them to see you, the physical therapist, how is that impacting their sleep? Because of course we see a lot of people who are in pain, people that have some sense of, worry about their injury or about their condition that may be contributing to a sleep issue. So I certainly don't want people just assuming everyone has insomnia and referring everybody to their physicians, because a lot of times it very well could be the reason that they're seeing you, the PT, that could be contributing to their sleep issue. So, kind of considering that. And then the next tier is screening people for the 3 most common sleep disorders in adults, which is insomnia, sleep apnea, and restless leg syndrome. And then there's kind of a bucket for everything else, the other, 97 sleep disorders that are possible. But really kind of helping the clinician to kind of, sift through kind of those decision points. And we actually just finished a study, it's under review right now for publication, where we invited physical therapists to apply the decision tree to 4 hypothetical patient cases, just to see if people could accurately apply the decision tree to those hypothetical cases. And then I would anticipate next step will be actually doing it in the clinic, would be where I see that research going. But we I've gotten some positive feedback from clinicians that it is helpful. It may somewhat depend on your setting. It's not really geared to pediatric setting, but I think it's a good, start to help guide clinicians in those different areas.
Yeah, and I'm actually going to have to get that from you after we're done with this today. But the thing that comes to mind a little bit with this is, finding ways to, I guess, have the conversation and then potentially not making an entire session about physical therapy on sleep. And we've been trying to, whether or not it's email drip campaigns or like quick hitting, pages on a website. What are some things that can help guide this decision-making process for somebody maybe making a couple general recommendations or potentially needing to tag in that other medical professional?
Right. Yeah, and I think so. I think the decision tree is certainly designed to help people screen for sleep disorders and know when to refer. But absolutely, providing education on sleep health promotion techniques really should be happening with everybody. It really just, for the person who is sleeping really well, they're getting adequate duration, they have adequate sleep quality, they most likely have really good, sleep promotion techniques that they're already using. But I think reinforcing those things is a great strategy to use. I would suspect though that there's always opportunity to be improving our sleep health. And so then you really do want to tailor then your recommendations to that individual, just like you would tailor your exercise prescription and your exercise recommendation. So you do the same thing for sleep. And so the way I kind of, conceptualize it is really into kind of 4 different buckets. And so we know that there are 2 physiological drivers of our sleep, one being our circadian rhythm, and then the other being our sleep drive. And basically sleep drive is, the longer you're awake, the more active you are, both physically and cognitively, the more tired you're going to be by the end of the day. So things that you can do to strengthen circadian rhythm, like having a really regular sleep cycle or sleep schedule, particularly prioritizing wake up time. And then also exposure to light first thing in the morning when you wake up, because that tells your brain it's time to wake up, it's time to stop secreting melatonin, and then also adequate sleep during the day. Because what we find is that for a lot of people, if they're indoor all day, they're not getting adequate light. So that actually can interfere with circadian rhythm. And then things to increase your sleep drive, being physically active, being cognitively active, reducing naps. That's a conversation I have quite a bit because as that sleep drive is, building up during the day, then if you take a nap, it does reduce your sleep drive. And so ideally, if you do need a nap, taking that nap earlier in the day, limiting it to 20 to 30 minutes, and then just know that if you do nap, that you may need to delay your bedtime so that sleep drive has enough time to build back up. So those are kind of the big strategies for circadian rhythm, for sleep drive. And then another big one is reducing arousal. That sympathetic nervous system that has a lot of value, for our fight and flight. But we also want it to be good and dampened, especially right before you're getting ready to go to bed. So that way, if you have a really strong circadian rhythm, you've got a really high sleep drive, if that circadian or if the sympathetic nervous system is still super high, you're still not going to be able to fall back to sleep or fall to sleep. So we do a lot of relaxation techniques. We tend to focus on deep breathing, 4-7-8 breathing, progressive muscle relaxation, and mindfulness. Mindfulness has been super helpful for a lot of people. So that's important to focus on. And then there's kind of the general, what we call, sleep hygiene. And that's the environment and behaviors that help to facilitate sleep. So other things like avoiding alcohol, being cautious about caffeine, nicotine's a stimulant, and then the environment too that you're sleeping in, making sure your bedroom is super dark, because again, the dark tells your brain it's time to secrete melatonin, it's time to be asleep. Keeping your environment cool, that's been shown to help us sleep better. And then of course, blocking out noise, because that noise can be disruptive of sleep. So those are kind of 4 big kind of categories. So as I'm hearing somebody talk to me about their sleep issues, I'm kind of funneling, those things into those different buckets. And then I know then which of those 4 buckets I need to kind of maybe put a little more emphasis on. But in general, the regular wake up time, exposure to light, increasing sleep drive, reducing arousal are going to be your key things to focus on.
That's super helpful. And obviously, a lot has gone into kind of packaging this, especially in your brain or somebody that's had a lot of familiarity with it. For people that are trying to find a way to integrate this, let's say into, their first interactions with somebody or subsequent interactions, what's the best way, or maybe sometimes the entry point to integrating this into the clinical practice?
Yeah, probably an easy way to do it. We have a handout. We have a single page handout. There's a version in the PTJ article that we published a couple years ago. We've since, gotten wiser and smarter and updated it. And then I just published one that is geared towards people with MS. But really, this information is, is applicable to everybody, regardless of, the reason you're seeing PT. But that's a really good version. We just published it last year in 2020. Again, it's just a single page. And what I did is I actually, have those 4 categories, and I've, put bullets under each of those categories for things to work on. So I think that's at least a good way, after you've screened people using the decision tree, a handout would be, a great tool to help facilitate the discussion. I mean, by no means would I encourage people to just, hand out a handout and say, go for it, get some good sleep. But I think you really then need to be tailoring it. And I would encourage people to be asking about sleep during your, your evaluation of the individual. But I certainly don't think it has to be, the sleep promotion techniques that you provide. I don't think it has to be like this, sit down, okay, here's our now 10, 15 minutes that we're going to talk about sleep health. I mean, I really envision it as being something that, you're integrating in your conversations that you're having with the individual over multiple visits. Because that is, I think some feedback that I get from clinicians is like, I already have all the stuff I have to do. I don't have time to do one more thing, which I totally hear and I totally appreciate. And so I think it would be, possible to, to have each of those 4 buckets on, 4 different visits. And as you're, helping them with their exercise or whatever intervention you're working on, then talk about that particular bucket, for the day, or that particular topic would maybe be a better term to use. So it doesn't have to be like one sit down conversation, but it certainly could be integrated over multiple sessions is how I would think it would work well into clinical practice.
Okay. Yeah. I mean, that's a great recommendation. I think sometimes, like you mentioned, people can get overwhelmed with how much they need to communicate to somebody, or they might overwhelm someone. What I'm also hearing is I'm not really hearing a whole lot of emphasis on anything such as like nutrition and supplementation. Is that because there is a role, or is there, or there's a provider that is best suited for that? Is that something, that you have conversations about as well? And is that just kind of a secondary thought? Talk to me a little bit about that, just because I'm thinking like, whether or not it's melatonin or ZMA, or if people talk about NyQuil. Obviously, we're trying to avoid something like alcohol, but is there anything else that goes into that decision-making process of what might be most appropriate?
Absolutely. And, and I think, obviously we're talking about sleep and sleep health here, but I think if we take, a step back, and if we look at this from a lens of overall health and wellness, then absolutely sleep fits in there, as does exercise and physical activity, as does nutrition, and as does, stress management. I kind of see all 4 of those as being incredibly important for overall health and wellness. So absolutely, in the interventions that I do with my clients, oftentimes nutrition does come up. There's some evidence that, we have a main circadian clock in our brains, but there's also evidence that there are circadian clocks out in the periphery, so out in our tissues and our organs. So there's some evidence that, things that are happening in the periphery also inform that master clock in our brains. So things like eating, having a regular eating schedule may actually influence your circadian rhythm, or at least the secretion of the different hormones that can then, again, inform that master clock. So when I have conversations, it's oftentimes, in the context of promoting sleep health. So things like, having a regular eating schedule, because that goes back to setting that circadian rhythm. But then also too, there's this, kind of bi-directional relationship between sleep and nutrition, right? Like if you're not sleeping well, you tend to make poorer choices about the foods that you eat. And there's studies that show that. But then too, when you're not eating a healthy, well-balanced diet, that also influences your sleep. So it's hard to talk about sleep without talking about good nutrition, good diet, exercise, and stress management, because they really do all influence one another. No, it's not a huge emphasis, but those things do come up. And again, depending on the individual, if that's something that comes up in what they're telling me, then we certainly have conversations about it. I think to get to your other question about, supplements for or sleep aids, right? Like melatonin, the NyQuils, Benadryls, those sorts of things. There's plenty of evidence that these behavioral interventions are very effective to help people sleep better. And so, of course, that from a healthcare provider, from a physical therapist perspective, I certainly want to promote, one, best evidence, but then two, staying away from, medications and supplements as much as possible. Then, of course, just the side effects that can happen because of those things, particularly like with the Benadryls and the NyQuils of being excessively drowsy, and especially in the older adults that I work with, being at increased fall risk. And I think the big concern for me too is that, oftentimes then those aids or those supplements become a crutch for people. Like they get into this, cognitive process that I can't sleep unless I take Benadryl or I take NyQuil or I take melatonin. And so that's always a concern, is we want people to learn that they can in fact sleep well without needing some sort of an exogenous aid to do that. And I can certainly talk more about melatonin. And I think the big issue with melatonin is people, they tend to take too much. The recommendation for melatonin is actually to start more at like 0.5 to 1 milligram, whereas a lot of the over-the-counter melatonin is more like 5 milligrams. So people tend to take too much. The other big thing is that melatonin really is effective to help people who have sleep-wake disturbances. So meaning like if you have a circadian rhythm shift where you go to bed really early, you wake up really early, or you go to bed super late and you wake up super late, then so you have a circadian rhythm issue, right? So then it makes sense that melatonin would be helpful to help regulate that circadian rhythm. So for those people, melatonin might be recommended. But most people don't have a circadian rhythm issue. So then they're taking melatonin when it's not in fact recommended. The other big issue with melatonin is that what you get as a supplement, the potency varies tremendously across supplements. So there was a study done a few years ago that looked at different over-the-counter supplements of melatonin and found that either it's under reporting the amount of melatonin in the supplement, or there's way too much in it. So that's a really big concern, as well as you don't necessarily know how much you're actually taking when you take the melatonin. And then the timing, people tend to take the melatonin right before bedtime. But really, if you're taking it for a circadian rhythm issue, you want to take it about 2 to 3 hours before your intended bedtime. So that way it helps to supplement the melatonin that your body is secreting. So it's probably way more about melatonin than you were really hoping for. But I get a lot of people who are taking melatonin in particular, and then other sleep aids. And I really want people to learn that, their body is going to do what it needs to do. And we just need to kind of help them get over that hump. Both, I think a lot of it's a psychological issue, that they really think that they need this to help them sleep. Now, again, that being said, if the physician prescribes melatonin or other sleep aids, then that's a conversation that I encourage the patient to have with their physician. I obviously am not telling people to stop taking whatever medication or to take medication, but that I do oftentimes, suggest that they might want to talk to their physician about the medication or ways to taper off the medication when it's appropriate to do so.
You went down a bunch of different rabbit holes there, but I think it was tremendous. I'm listening again, and I'm like, well, there's so many topics that I think that people have been exposed to that you just touched on. And one of the things I want to dive into a little bit more, the psychological piece, and knowing that sometimes in situations surrounding individuals that are suffering from chronic pain, maybe providing a little bit more, your clinical pearls of things to consider with people who are going through, say, chronic back pain, chronic neck pain, or something else, and some considerations for integrating more of a holistic way of helping them out with health promotion, whether or not it's education or sleep hygiene. Where's the best place to potentially initiate a conversation, and then ideally provide them with resources that are more focused on addressing some things that pop up in chronic pain situations.
Yeah, absolutely. And I think that is definitely, a patient population that we see a lot of sleep issues in, obviously. And probably a lot of the listeners are like, yeah, those are the patients that a lot of times have sleep issues. And I think there's the kind of the basic information about how, sleep and pain are interrelated, like the areas of the brain that regulate pain modulation are influenced by sleep, and particularly sleep deprivation. So there's been lots of really great studies that show that when you are not getting adequate sleep, that those descending pain modulators are not able to function as well as they should. I think it's also fascinating that, when people sleep poorly, they're actually at an increased risk of developing chronic pain conditions. And I think that's, I don't think we talk about that nearly enough of, gosh, PTs and other healthcare providers, like if we could help people sleep better earlier on, could we prevent, some of these pain conditions from developing? There's no research on that yet, but I would suspect that there's potential for that. But, I think specifically for people who do have chronic pain, talking about sleep health promotion is absolutely an important topic. If you're not already doing that, and with all of these, recommendations that we make for sleep health promotion, just like any other recommendation we make, there's kind of always this like best case scenario, like here's best case scenario of what you would want to do, right? Like wake up at the same time every single day. And then there's like worst case scenario, right? Like on the other end of the spectrum of like, having a completely variable sleep schedule. Well, obviously there's a lot of in between there. And so you might have to be kind of considering modifications that would have to be made for that specific patient, and pain or not having pain. Obviously, you're tailoring these interventions or these recommendations for that individual. What I oftentimes see in people who do have chronic pain is, and I think this is an area that we could be providing education about, is that they oftentimes spend time in bed not sleeping. And that is problematic because you want your brain to associate your bed with sleep, right? Like you want to get into bed, your brain goes, oh, I'm in bed. That means I should be asleep. And you fall asleep super quickly, right? You don't want your brain to associate your bed, one, with being awake, right? Like, because you don't want to get in bed and your brain's like, oh, this is when I get to, watch TV or I get to worry about things. And really, I think for the chronic pain group, an issue is that if they're in bed, not sleeping, and they're having pain, like then their brain starts to associate the bed not only with just not sleeping, but then also with this pain experience that they're having. And so certainly, if the individuals are not sleeping, the recommendation would be to not be in bed. And absolutely, if you're having, an exacerbation of pain, do what you need to do to help with that exacerbation, but ideally not doing it in bed, and not even in the bedroom would certainly be ideal. And then too, I think, we can also help normalize sleep disruptions. I think there's so much emphasis, and I'm guilty of this too, of being such a, an educator about the importance of sleep. I think in some regards, we can almost take a little too far. And then, I've had people then start to get really worried, like, gosh, I'm not getting 7 hours of sleep every night. Am I going to develop Alzheimer's disease? And it's like, here and there, having disrupted sleep is probably in the grand scheme of things going to be okay. Now, absolutely, you want to be getting into better sleep as quickly as you can and have more good nights of sleep, right? But I think assuring people that, especially people who have pain, like it'll be okay. And then again, for those people, if they do need to take a nap, I certainly promote that individuals know what's best for them and know what's best for their body. So they may need to take a nap during the day to help, kind of compensate for not getting sufficient quality sleep at night. And then again, it's, yes, that's absolutely okay to do what you need to do. Just know though, that you may have to delay your bedtime until you're adequately tired and that sleep drive is built back up. So I think supporting them in both, these sleep promotion techniques, tailoring it to those individuals and modifying them as needed. And then two, normalizing that, keep with these strategies, likelihood that as these issues are being addressed, that things will get better.
I'm now going to take this a different direction, and this is only because of my personal experiences and my own personal bias, I guess I should say. What are your thoughts on a coffee nap? And I know I'm putting you on the spot right now.
A coffee nap? So you drink coffee and then you take a nap?
Yeah.
So what?
I know, why
why would you do that?
Just something. Some people swear by it. That's honestly not something that I do regularly. If I need to nap, I usually nap pretty easy. But yeah. I just thought I'd put you on the spot. And that, in addition to blue light blockers. I mean, what are your thoughts on blue light blockers? They work? Yeah. They not work? What do you think?
Well, so we'll talk about blue light blockers, but with the caffeine and the nap, I would suspect if you can drink a cup of coffee and then take a nap, that you're probably not getting adequate sleep at night. Would be my suspicion. So I would probably encourage you or whoever is doing this to maybe consider having longer and better sleep at night, and then you most likely wouldn't need to do the caffeine plus nap during the day. For blue light blockers, that's again a great question. There is some evidence that, especially in adolescents and young adults, that the blue light that gets emitted from devices does reduce the amount of melatonin that gets secreted. But that being said, older adults, probably even middle-aged adults, seem to be less sensitive to blue light, but it is more sensitive in adolescents and young adults. But I think, so the blue light is one issue. And so, yes, if you have to be on a device and you're an adolescent, you're a young adult, maybe even into middle age, then using a good quality blue light blocker, you might want to consider doing that. I guess I would also then ask is, what's the reason for being on the device? Do you have to be on the device? Because it's not just the blue light that we get concerned about, I get concerned about, but it's also just the content. It's, what are you engaging in content wise? Is it something that's going to get your sympathetic nervous system going? Is it also going to be something that just sucks you in, right? Like you're supposed to be in bed at, 10:30 or 11, and you decide to watch one more episode of whatever. And then the next thing you know, you're watching another episode, and then it's midnight, and then you've missed your bedtime. So yes, blue light's one thing to think about, but then there's also the content, and then there's also the time suck that goes into being on devices.
That makes me think of a phrase that I heard recently called digital wellness. Something I've never really, I guess I've heard it mentioned, but not specifically in that manner. But when I think of sometimes content, whether or not it grabs your attention for a long period of time, or it's something that might upset you, it might throw you off emotionally, and the word arousal pops up again. Mm-hmm. So yeah, that's something that definitely makes sense, especially around the bedtime. But taking this away from caffeine and coffee naps and blue light blockers back to something that occurred last summer with the HBAT, HOD approving their motion on PT's role in sleep health. And then from my awareness, wasn't sleep also mentioned as a vital sign? And I'm trying to remember who that was recently through, but I think they mentioned that PT should almost be considered a vital sign for individuals in terms of health and wellness. Where do you see this going, given these new initiatives? What are your thoughts?
Yeah. And I don't know that sleep has been, and I don't know necessarily who is the body that decides what the vital signs are. It probably depends on who you ask. I think there's been, suggestion that sleep might be an important vital sign. I've probably used that term myself because, absolutely the amount of sleep you get, the quality of sleep that you get, is a vital sign in the sense that it probably gives you some indication of the overall health of the body. So in that regard, I would consider it a vital sign, just as vital as, heart rate, blood pressure, respiration rate, those sorts of things. As far as the House of Delegates voting to accept a motion about the PT and PTA's role in sleep health promotion, that did happen over the summer. The Kansas delegates, as well as the Washington delegates, put together this bill together. and put it forward for a vote, and it passed, which I'm super excited about. It's fascinating to kind of learn about the process of House of Delegates and how these motions happen and pass. It was a great experience to be a part of, just for my own education about how these things work. But sleep health was actually included in a different motion, or a different position statement, but it was one about kind of health and wellness. So it included, nutrition, exercise, of course, stress management. Sleep health was mentioned in one of those. And then what happened is that as the House of Delegates was kind of cleaning up some language in in these position statements, sleep health was actually removed. I think it was probably inadvertent. At least that's what I like to think. That it was a little bit of an oversight in an effort to kind of streamline language and be consistent with language. But really, it afforded us a really fantastic opportunity, in hindsight, and looking forward too. It's a really great opportunity. There was a motion that was put forward and accepted on the PT's role in nutrition. And I think this, having a separate position solely on sleep health, I think really just speaks to the importance of the PT, the PTA, being involved in screening for sleep issues and promotion of sleep health. Just a little, to me, it solidifies our role in that area. And so I'm personally super excited about it. I hope that it gives, clinicians maybe some empowerment and maybe some, increase in self-efficacy that they can in fact do this. So I am super excited about it and happy that we were able to be a part of it.
I'm excited about it, and I'm almost like overwhelmed at the same time, because it's like, all right, we're pushing towards more direct access. Nutrition is on the board. I've got sleep on the board. I've got cardiac screening on the board. The last podcast we did was on pelvic health. So just being more aware of when to potentially ask questions and, insert ourselves into these discussions with people. So that is the art, to ideally blend all of these different areas of the evidence and the science that comes to clinical practice. But to kind of wrap things up a little bit, what are some things, or I should say one thing, that you want to share that you're working on that you're particularly excited about right now?
Yeah. So I am super excited about this paper we're going to have about the PTs applying the decision tree to the 4 hypothetical cases. I'm super excited about a clinical trial that we're doing right now, where we're looking at the use of CBTI, so cognitive behavioral therapy for insomnia, and we'll be randomizing 200 older adults into either a group that gets CBTI or an active control. And we're looking at if we can help people sleep better and if we can increase their slow wave sleep. Does it actually improve cognitive function and reduce the rate of beta amyloid accumulation in the brain? Of course, beta amyloid is one of the risk factors for Alzheimer's disease. So we're year 2 and a 5-year NIH grant. And so if we can pull this off, like if we actually support our hypotheses, like that will be super amazing and super cool. So stay tuned in like 3 years, and I can let you know how that turns out. But yeah, if we can have an impact on risk of Alzheimer's disease, that would be really amazing.
Yeah, no, I agree. That would be tremendous. I mean, it's obviously something that, at least from my awareness levels, only increasing in its prevalence. There's a lot of different things that we have mentioned to potentially reduce the incidence of it, but it seems like it's still trending negatively. So I'm super excited about that. Super excited for you. I'm also just very appreciative of you being on here today. And I can imagine that some people are going to want to reach out. There's some of these topics today are going to really just kind of spark some interest. Where are the best places for people to reach out to you?
Yeah, absolutely. And I mean, I know people say this and maybe don't always really mean it, but I really do mean it, that I love to talk about sleep. And maybe that's apparent and my effusive answers for some of your questions. And so I really do encourage people, if they have questions, they have discussion, they have, cases, I'm happy to chat. Probably the easiest way to reach me is on Twitter. I'm fairly active. I am at Katie Sleep PT. You're also welcome to shoot me an email. My email is I'm Catherine with a C, which makes it super confusing. So it's C and then last name Siengsukon at kumc.edu. either way is a great way to reach me, and I'm always happy to continue the conversation.
Awesome, Katie. I really, really appreciate it. You answered some questions for me. I probably will have more questions as well, but I do appreciate you taking the time from Kansas City today. And yeah, I just look forward to staying in touch with you. So thank you.
Absolutely. Well, thanks for having me and giving me the platform to talk about sleep health and how PTs can do it.
Absolutely. Have a great week.
Thank you.